Hey everyone! Welcome to a special episode of Why Should I Trust You? We had another conversation, a third in our series of conversations with folks from the Make America Healthy Again movement and some people from public health. We got into a lot of stuff. This time we talked about the COVID vaccine and the kind of legacy of it. We'll explain more, but let's just get right to it. Hey, everyone.
Welcome, everybody.
Welcome to the special episode. Tom, it is Tuesday.
That's right.
And Maggie and Mark will be back with us on Thursday. And who are we? I am Brenda Adhikari.
And I'm Tom Johnson, and we're both journalists. And you're listening to Why Should I Trust You?
So, Tom, we did it again. We did another one of these conversations. And this one, we actually had a few new faces on this one.
Yeah, we did. We did on both sides of the conversation. Again, this is public health veterans from all around the country. And this time we talked to some MAHA volunteers, advocates from the state of Georgia. And it was a good one.
Yeah, it sure was. And again, why are we doing this? We're doing this because these are people who don't frequently get into conversations with each other. They are folks who think a lot about the same things, about the health of our country, the health of our children. And, we're at this kind of inflection point in our country where so many people are not trusting institutions, are not trusting government, are not trusting the scientific and medical establishment. And we really just want to engage folks like that in conversation. So yeah, we were really excited to do it. I think with this one, you'll find that they get into some harder shit, Tom.
Yeah, right out of the gate. The Ohio conversations were terrific. This one, I would say, was different in that, people came to the conversation with a real profound concern. And it would just right away, we got into, I think you raised the topic and we ran with it, which was the COVID vaccine. And,
right.
One side from the MAHA perspective, profound concerns about it. And on the other side, a sense that this was and is a miracle of science, of modern science. There's a robust future here that could make all of us much healthier than we are now. And yet the mistrust and the anger around the COVID vaccine could be pulling all that down.
Yeah. And, in so many ways, COVID is this Rorschach test in our country for how we view trust in institutions. I can imagine someone listening to this saying, why do you keep going back to COVID? Like that was 5 years ago. We've moved on. I'd say we haven't moved on. And this conversation, I think, lays that bare pretty clearly. And so just a few things, there were a lot of facts thrown around. We didn't kind of tell folks if the mainstream scientific consensus feels differently about anything mentioned because we just, honestly, we thought it was important for people to feel heard and for people to talk, to speak what they know and why what they know makes them upset and mistrustful. Look, we want to tell you who was on this call on the MAHA Georgia side. You have Joey Fargar, who is the theater director, a choreographer, a dad. You have Aaron Rossi, who is a chiropractor and says that Bobby Kennedy's work has been instrumental in helping him teach the public about health matters. You have Christy Kennedy, who's an occupational therapist and a clinician, and she established her own private practice. And you have Melinda Hicks, who is a MAHA mom. I guess everyone here is a MAHA supporter. I should just say that. She was a Kennedy volunteer. She was a leader in the Georgia campaign efforts, and she was pretty frustrated with the conventional medicine model and has now embraced alternative care. And then we also invited back Elizabeth Frost from MAHA, Ohio, who ran grassroots for Kennedy's campaign in Ohio and still continues to be a part of the leadership of the MAHA movement. Tom, you want to list the public health folks?
Yeah, we had Paul Offit, who, if you've listened to this podcast, is a regular. He is an infectious disease pediatrician and co-inventor of the rotavirus vaccine. Reed Tuckson, the director of Coalition for Trust in Health and Science and the former commissioner for Washington, D.C.'s Department of Health. He's also a physician. And Ann Zink, a former chief medical officer for the state of Alaska. And she's also an ER physician. And then finally, Ashwin Vasan, former New York City health commissioner. He was there 2022 to 2024. He's a physician and also an epidemiologist.
Just a couple of housekeeping things. I hope that you are able to kind of follow the bouncing ball of who's saying what. We tried to identify everyone, but I think it'll be pretty clear based on what folks are saying, who's who. And then there were just a couple of spots where the Wi-Fi cut out, but like 98% of it is like totally fine. So forgive us for a couple of technical things, but we really hope that you find this conversation as interesting as we did. And we started off with a question about the COVID vaccine.
Why don't we start off with just a general question? In 30 years, what do you think the history books or Wikipedia or online sources should say about the COVID vaccine and the efforts to get folks vaccinated? How should people remember this moment? Aaron Rossi.
Yeah, this is a topic I am kind of hot on. If you're thinking 30 years from now, right? This is my take on this. I think 30 years from now, we'll look back at the COVID shot as probably one of the worst medical interventions since the lobotomy. I also think that the effort to get people vaccinated the way it was done was a catastrophic trampling of our rights. And it's probably going to be the turning point that destroyed the public's health, the public's trust in official channels. I interact with people often that feel that way. I personally do actually feel that way. I know that there's some shots over the bow right there.
No, listen, I said don't censor yourself. Let's go Elizabeth Frost. So I'm just going to say Elizabeth Frost from MAHA, and that was Aaron Rossi, also from MAHA.
Yes. So to me, I think the biggest takeaway from this is going to be, to Aaron's point, that the censorship and the mandates, and I think just the general tone that was kind of directed toward people who were skeptical of the mRNA vaccine is going to be remembered as something that really damaged, I think, the trust between people who were skeptical of the vaccine and the public health institutions that, to be fair, I do believe were, trying to help people stay safe in the best way they knew how at the time.
Thank you, Elizabeth. Let's go Dr. Paul Offit from Public Health.
So I see this at two levels. One is that I think in many ways it was one of the greatest scientific or medical achievements in our lifetime, in that starting in 1997, you had people like Drew Weissman and Katie Carrico working as funded by NIH and were able to advance mRNA technology to become a vaccine for which they won the Nobel Prize deservedly. And I think Operation Warp Speed was one of the greatest medical or scientific achievements also in my lifetime. Within 11 months, you had done 2 large clinical trials, and the vaccine appeared, at least on those tens of thousands of people, to be safe and effective. I think where we failed, and this is where I sort of agree with Elizabeth, I think that we failed in many ways. I think we failed to explain what this vaccine could or couldn't do. I mean, it is very good at preventing severe disease, but after 6 months, it's not going to be very good at preventing mild to moderate disease. And so we didn't, I think, explain that. 2 is I think we were way too heavy-handed in terms of how we mandated the vaccine, shuttered schools, closed businesses, restricted travel, and it was done in a way as this is what we're going to do. I mean, there was no explanation behind it. I think it was in a dictatorial manner that really put people off, and I think we are still suffering that. But I think it's just looking at it as a scientist, I think it was a phenomenal scientific achievement. I know that's not necessarily popular here, but I think it was remarkable. I just think we messed up, and especially in those first 2 years of the pandemic.
Thanks, Paul. And Zink from Public Health.
Yeah, no, I appreciate the question. And I think it is something that we need to continue to just really dive into. I think about this in kind of 3 different buckets. I think 1, the COVID vaccine laid bare the difference between public health and healthcare and the failures in the healthcare system. And I think right now we're blaming public health for a lot of the challenges within the healthcare system. And I think we need to call a spade and understand where the differences lie so that we can make systems work better for people. And I think ultimately we need a health system, not a public health system, and a healthcare system that are so definite. And I think that this just was like a big Band-Aid that came off, and we saw a lot of the gaps that were there. I think secondly, I think that this is like a very I think public health has had this very kind of in the closet kind of mentality of I'm just going to tell you what needs to happen. And I think healthcare moved to a process of shared decision making 5, 10, 15 years ago. And I think on that kind of deeply personal relationship component. And I don't think public health moved that direction. And so I hope that this is a wake up call for public health to move to shared decision making with people on what they need to do, what makes sense for them, and making sure it's deeply personal. And the third thing I wanted to highlight is that, I worked the whole time in Alaska during the space, and Alaska Native people talked a lot about the Great Death of the 1918 pandemic. And I think, unfortunately, we have forgotten some of the history and past, but now I hear about the COVID response as being the Great Resilience and having tools and resources to not succumb to a great death. And so I hope that as we're able to take processes and learn from this experience, that we will also be able to take the good that happened in. I agree with Paul, like being able to see the mass scientific effort that happened in a really short period of time, that we'll be able to take the good and the bad and create more resilience moving forward.
Thank you, Anne. Melinda from MAHA, Georgia.
So, yeah, and, it's interesting. I did a little bit of research on you. I really appreciated that you were supportive of people getting outside during the pandemic. That's something that, was really, really bothered me about what happened. There was a complete overreach, and we know that. I agree with Erin in that, we were told that, the spike protein would stay in the arm. And then later we found out, that it went to multiple organs. This is not stuff I'm just believing. These are studies that are out there. We've had safety signals, myocarditis. I mean, we finally now are getting those safety signals put on those. The FDA is requiring it on the vaccines. We've known this for years. We've known this for several years. That's a real problem, especially for someone like me who already had some mistrust. I saw a friend die of a brain hemorrhage for absolutely no reason. Another in her 60s had 2 strokes, no pre-existing condition. One of the things that stood out to me was when my friend was telling me about her wife who had had these strokes, and she was telling me all the possibilities the doctors were looking at. The one thing that they didn't talk about was her multiple COVID vaccines. And this is a woman who'd already had a full body rash and some sort of, major issue with the vaccines, to the point that she stopped taking the booster. I think it was the first or second booster that gave her that full body rash, joint pain, all kinds of things. And so I feel like doctors and public health were not putting together the pieces and looking at, okay, we've got some issues. I think the vaccine, I would have been a bigger supporter of it if it had gone out to the most vulnerable, as opposed to this, massive campaign where everybody should get it, regardless of how many COVID infections you'd had, when you'd had them. And then, we buried stuff. I mean, I followed some of what Senator Ron Johnson did, bringing in a lot of those people that were suffering and still are terribly. Those people have not gotten, they've not gotten treatment. They've not gotten help. They've been gaslit. They've been told they have anxiety. And Senator Ron Johnson brings them together. And within a couple of days, multiple social media sites where they were all gathering, talking about their different issues, what they were doing, just trying as a group to heal, to figure out what was happening to them and to share their stories. And those sites got shut down. So I think in 30 years, I can realize that we made some massive mistakes. We made some massive mistakes in assuming that everybody, was the same, that everybody needed it, and that we found safety signals and in our zest to make sure that we killed this virus and, helped people, that in fact we ended up hurting many, many people that in the end really weren't at risk for COVID. So that's my thought.
Thank you, Mel. Okay, Christy Kennedy from MAHA.
Thank you. I think I see a bigger, maybe a bigger picture here that I'm really hoping that we can really grasp and understand, is that my hope is that in 30 years, we will be far beyond this separation, or this focus on the germ theory, which is really what I think has turned our whole medical community upside down, without recognizing the homeostasis theory that is still very viable, that is only becoming more and more significant as we understand our immune system, we understand our gut as a second brain, And my hope is that we will move past this propaganda that is occurring within the medical community by big pharma to minimize their ability to see past pharmaceuticals as the approach, because there were a lot of strategies and protocols that were being used under the table that were effective and that were significant and needed to be more recognized, but yet were discounted and even demonized as this is going to do more harm. You need to not trust those supplements or those even the medications like ivermectin that was won a Nobel Prize for how effective it was and how safe it was. The problem was it was inexpensive. And the bigger problem is that and I'm going to get some of the terminology wrong, but the HHS, I guess, needed to have no current pharmaceutical available to be used before they could introduce a new pharmaceutical. And so my hope is that we will recognize that big pharma is influencing so much of our inefficiencies in addressing the diseases that we have and supporting the people, and that COVID was simply their mouthpiece that just took over everything and blinded the whole medical community from being able to see and use the science that they've been trained to know and they're so capable of using, but that it was just a disastrous in terms of being able to use the knowledge that we have and that we should be able to be using.
Thank you, Christy. Ashwin Vasan from Public Health, please.
I'm listening really carefully, and I thank everybody for sharing. I'm not going to react to different things said, but I want to say this. I mean, I live in New York City. I'm a New Yorker. And one of the things that makes me hopeful for these conversations, but also really sad, is that I think we forget how scary this was and how much death we were surrounded by, particularly in that early phase. In New York City, we lost about 50,000 people, and half of those were in 3 months, the first 3 months. And I not only was working as an attending as well as running a nonprofit trying to protect people here before I became health commissioner. I live around the corner from one of those hospitals that you saw on TV with the freezer trucks and the bodies being taken out. We had a mass burial grave on Hart Island because we couldn't identify all the bodies fast enough. And I was just like, I can't believe this is happening, right, around us. So I'm not saying that to in any way react to anything anyone has said. I just want to somehow, I think we've lost some of the human element of this conversation on both sides, right? And so I hope that as we look back on this in 30 years, that we never forget that piece of it, that there are just so many tragedies at every level of this pandemic, so much human toll, so many emotional and mental health impacts that are still rippling through our society as a result of all this death and disease. And I agree with everyone to say that there has certainly been a loss of trust. I think probably if you asked me to summarize where I actually stand on the substance, it's quite close to where Paul is, in that I genuinely think it was a remarkable achievement to get this vaccine created and manufactured and delivered in the way that it was, especially at a time under a totally different administration, especially at a time when we're so polarized, we have so little faith in government, we have so much skepticism of the private sector. We saw those two institutions work together for the common good, or at least they thought they were working for the common good, right? And I think that is something we shouldn't forget. But I think about this a lot, having held the role that I held. How did we message? Were we too one size fits all in the way that we talked about this? Were we too heavy handed? I'm that keeps me up at night. It kept me up at night for years. And I think those are the lessons that public health certainly needs to take on board for the future. I think of it a lot like parenting. You know, I have an 11-year-old who might as well be like an 18-year-old because of the way she talks and thinks. It used to be when I grew up, and probably when most of you grew up, when your parents said do something, you just did it, right? For the most part. And when you challenged them, you found out, right? Now everything's a discussion because there's so much information out there. There's so much access to information. And I'm not saying that's a good or a bad thing. It just means you have to adapt your approach. You have to adapt your approach, and everything becomes a conversation. And that's just how it has to be in this current environment with all this information swirling about. We have to be in dialogue with people, and we have to shared decision making is the kind of, the wonky word that we use, but it's really just about talking to people and trying to find common ground. And I find whether I'm trying to convince someone to take a pill or to exercise more or to eat better or to take a vaccine, the more I talk to them about anything but that and get to know them, the more that my message lands whenever it is I do deliver the specifics of the science or the treatment or the preventive. So those are just some reflections, but I'd love for us to not lose sight of just the human piece of this on every side. There's just so much human pain and suffering, and that binds us, right? Like that, we're in a human project. Like that's bigger than all of us. When the aliens come for us, man, we better be together, right? I'm just teasing. But like we're a human race, and that comes first, right? And I like to think about that project as bigger than any other project that we have. So I'll stop there.
Thank you so much. Reed from Public Health.
I'd like to just ask a question that follows up on Ashwin, and I see Joey's hand is up, and maybe he can respond as well. I think that what we are obviously aware that there were mistakes made in implementing this issue, and we can, in public health, we're going to be beating ourselves up and learning, and we're going to be listening to you, and that's going to be part of our beating up and learning. What is missing from this, I think, is what Ashwin sort of got at. You also the context of losing more than a million people. I mean, we lost a lot of human beings, and we're forgetting that those of us who have responsibilities for having to intercede to keep that death count as low as possible, recognizing that the vaccine did save hundreds of thousands of lives. So we have problems, you have issues, but it also, to do nothing, to have sat back, would have been another level of challenge. So I'm wondering, with that sort of context, how do you think, and how do you, I guess more importantly, how do you think we should think about the kind of challenge that we were facing? What would you have done with those bodies piling up at the hospital in refrigerator trucks? And you have a vaccine that does work. What would you have suggested that we have done differently?
You're muted.
I know. I'm so sorry. Joey from MAHA, do you want to take that?
Well, I think my answer, and the reason why my hand is up, is going to kind of, help answer his question a little bit. I would like to take the conversation with the question back to, why should I trust you? Because to me, this is imperative. Yes, it is true that a lot of people died, and we were all scared. And those of us who were going into this insanity were already dealing with a medical field and a big pharma world where we already didn't trust before this even happened. And then this happened, and all of a sudden there was this entity brought into the conversation called mRNA. It was a treatment. It was called a vaccine. In our world, from way back, we were all told, and we believed, that a vaccine is a drug that you take or a shot that you take, and you can't give or get whatever the disease is that we're treating, or the virus that we're treating. And then this treatment came along, and now we're being told that all the studies were done in 1997, and so it's this incredible new scientific invention that's just going to sweep through our country and save everybody's lives. But it's being called a vaccine. Well, in our world, a vaccine is something that if you take it, you can't give or get it. And then we were told this particular treatment, they called it a vaccine, you can't give or get it. So everybody trusted that. in the world, while some of us were going, oh, I don't know. Even if you did the studies back then, what kind of studies did you do? Well, if you did the studies back in 1997, then why didn't you know that this treatment would not stop transmission, would not stop infection? But you told us that it would. So people were taking it out of trust. And then, we were vaccinating 12-year-old children who were then going to visit grandma with a loaded gun, thinking that they couldn't give it. And now all of a sudden we learn 3 months down the line or whatever, oh, if you took the vaccine, you still could get it. You still can give it. It was a big, huge misdirection in many of our lives. So for me, again, I would love to see in 30 years that the big pharma and the medical field especially have learned how to speak to us in a way where we're not spoken to like we're 3-year-olds. We're adult human beings who have the responsibility of keeping our children alive. If I make a mistake by giving my child a drug and that child dies, that's on me. If I follow the advice of a doctor who tells me to give my child a drug and then my child dies from that drug, their child didn't die, my child died. So it's imperative of the medical field to understand that when they advise us, ultimately, whatever decision that we make on how we're going to treat our children and try to keep them alive as long as possible, it's our child that dies, not your child. So how you speak to me is going to be imperative on whether I trust you or not.
Thank you, Jody.
Sorry to be so passionate.
Melinda Hicks from MAHA, please.
Okay, so I want to pick up on something that Joey said about, this vaccine. And this is one of the things that I think it shocked the hell out of me. But sometime between September 1st and September 2nd of 2021, the CDC changed the definition of what a vaccine is on their website. It went from being defined as a product that stimulates a person's immune system to produce immunity to a specific disease, protecting that person from the disease. On September 2nd, they removed the words protecting that person from the disease. Now, if you want to create mistrust in people, you change unilaterally a definition that's been around for 200 years. And you do it with, no explanation, no public hearing, no nothing. And, that alone is like, I would love for someone from public health to talk to me about that. How is that possible? And it seems to me, and you can call me a conspiracy theorist, but, I can put 2 and 2 together and get 4. It seems to me that we're in the middle of this crisis. This vaccine is out there. It's not stopping transmission. It's not stopping infection. And the CDC suddenly changes the definition of a vaccine. That seems very conspiratorial to me. So somebody please explain that to me, how it's not.
Okay. Paul, do you want to take that just because it's a direct? Yeah.
Sure. So SARS-CoV-2 virus and COVID, this is a short incubation period mucosal infection. So incubation period is from the time you're exposed to the virus to when you develop symptoms. The best you can hope for following either natural infection or vaccination is that you are protected against mild to moderate disease for maybe 4 to 6 months, and for protection against severe disease for much longer. For the longer incubation period diseases, measles, mumps, rubella, German measles, polio, smallpox, you can eliminate those diseases. And so that's the problem, is how you define the word disease. So in other words, I think where they felt trapped at some level, and it was a mistake that was made. And here's where the mistake came from. I'm on the FDA Vaccine Advisory Committee. When we reviewed the 2 studies done of Pfizer Moderna in December of 2020, the 40,000 person trial, the 30,000 person trial, if you looked at protection against mild to moderate disease, it was 95%. There's no way that was going to last. The reason it was so high was that those were 3-month studies. Those patients or participants had just received their second dose, so they still had high levels of antibodies in their bloodstream, which will always fade after 4 to 6 months. And this gets to the transmission thing. I mean, you can eliminate measles from this country. We did by 2000 because it's a long incubation period disease. This virus will never be eliminated. Even if everybody in the world were vaccinated every year, the virus would still circulate and cause disease. And I think that's what we didn't explain well, especially when we mandated vaccines and people were losing their jobs and they would still get a moderate disease, which is not trivial. I mean, you're still home for a few days, coughing, fever, chills, really uncomfortable. I think that was where it all fell down. And I can explain to you why it fell down, if that helps at all. I mean, we were, as was said before by Ashwin, we were overwhelmed with this virus in our hospital. I mean, for that first year, and I'm in a children's hospital, where it's not nearly as overwhelmed, say, a hospital takes care of adults. We had 3 floors of COVID. We canceled emergency surgeries. Nurses were wearing bandanas for face masks and trash bags for gowns. And you were 12 times more likely to be hospitalized and die from that virus if you were unvaccinated. Vaccinated in 2021, about 6 times more in 2022. So what was done, and I don't agree with this, but what was done is we overpromised that vaccine. And the notion was that you could stop all transmission. Now you do, by the way, just so we're clear, you do lessen transmission. You do. And I think the mistakes that were made early were that people were looking at PCR to look at transmission. They should have been looking at infectious virus. So it created, frankly, the false notion that you were always shedding the same amount of virus, which isn't true. But I think the mistake was we should have explained all that. We should have sat down and explained all of it so that people could understand what this vaccine could or couldn't do in terms of disease, in terms of transmission, because people like you are obviously intelligent and are reading this and thinking, these people are lying to me because they're not telling me the truth, because we didn't explain it well. And I think that was our mistake. And I think we didn't explain it well because we were so desperate to get people vaccinated so we could fall down off this curve because we were just being overwhelmed with this virus. I think that's where that came from. So, and it was never nefarious. I don't think people were, it was not nefarious. I think it was just desperation, and it was a mistake.
Well, okay. So since we're talking, what I'm specifically referencing, though, is the CDC's definition of vaccine. Why was that changed? Was there desperation in that? I mean, yes, there were issues with the way that it was presented to us, and I have a couple questions about that as well. But specifically, the changing of the definition of vaccine. Where did that come from, and what right did they have to change the definition of a vaccine? Do you see how it looks to us that in the middle of a vaccine that isn't stopping, infection and transmission, the CDC changes the definition? Why? And why is that allowed?
Okay, so the definition of a vaccine is something that induces an immune response that is the consequence of that is found after natural infection without causing the price of natural infection. That's what a vaccine is. So what got hung up in this definition was in terms of what you're protecting when you say infection. Do you mean infection, which is it's not going to be very good at? Do you mean disease? Yeah, certainly it's very good at preventing severe disease. Or do you mean all disease? And I think that's where things got confused, because people were saying, look, I was mandated to get this vaccine, and now I've been home for 3 days with a cough and chills and fever, and they lied to me. And I think that the change was, what did we mean by disease? But again, instead of trying to do that in 2 sentences on a website, it would have been much better if this was done in person. And I just think we were really bad at this. I think we were dictatorial where we didn't need to be. I think we felt that nuanced information was something the public couldn't understand. And I think we made a mistake, and we caused this enormous amount of distrust, which is what you're all saying here. We didn't trust the American public to explain in depth what we meant by protection against disease. And I think because we were so desperate to get people vaccinated that I think we overpromised that vaccine in some level.
But the CDC making that change was not something that most people even would have seen. So based on the September 1 definition of a vaccine, that it is supposed to protect the person from the disease, are we saying then that the COVID vaccine is not actually a vaccine?
No, it's a vaccine because it does what a vaccine has to do, which is protect people against severe disease. Keep them out of the hospital, keep them out of the ICU.
Okay,
yeah, so let me jump in, and I want to kind of keep it moving. I think, Mel, you're raising a good point, which is that clearly something occurred that the change of which created suspicion, right? It created the smoke. And I think, I don't know that anyone here can speak exactly for why the CDC did what it did. But I think it's fair that you're saying that caused mistrust. I think everyone here is probably trying to figure out why. So I just want to make sure everyone knows that, like, let's remember that no one here is officially speaking for CDC. It's hard to know on a front-facing website why CDC did that. But let's keep things moving. I think that was a good back and forth. And, like, come on, we got this, guys. Elizabeth Frost.
Two sentences. Let me just say two sentences. One is, I understand Dr. Offit's position and Melinda's position. I think that really, if we're going to go to the world of why should I trust you, which is what this is about, we have to change the name of this new treatment. They can't both be called vaccines in the layman's world. Now, in the scientific world, Dr. Offit, I get what you're saying. You guys see it differently, but if you're trying to earn our trust, you can't use vaccine for both of these technologies. We have to have different words for them so that we, as the average American, know the difference between the two.
But it's not a treatment. You're not treating anything. You're preventing something. Vaccines.
All right, then find a new word for it. It just can't be vaccine, or else it's not going to fit into our world for the last 30 years if your goal is to earn our trust.
All right, well, let's keep going. I think that's an interesting thing you're raising, and let's put a pin in that, and we'll come back to that. Elizabeth Frost, MAHA.
Yes. So I wanted to touch on something that Ashwin and Reed had talked about, which is, the human experience of being a doctor, being a physician, being, a leader in public health during the time of COVID, particularly in population centers like New York, where you are seeing numbers, like 40,000 people, 50,000 people, passing away from this virus. I think there is a trauma in that can absolutely, I think, trigger what a lot of folks in MAHA would have seen as an overreaction, but I also want to touch on the other side of it, because I do absolutely hear, and resonate with how incredibly difficult it is to be watching your patients pass away from an illness, and you just don't have the tools to help them. And I think that there's a lot of empathy to that on the MAHA side. I know that there's, a disagreement, between ivermectin and hydroxychloroquine. There's a lot of data that shows, when administered later in the infection, that it can be harmful. And then there's a lot of, doctors and nurses on the ground who have said, okay, but I've seen this save people. And if my only other option is a ventilator, I want to try this. I've seen it work sometimes, and I know, how damaging and dangerous a ventilator could be to them. So if this is my only option, then I want to try this. And so, I definitely feel like the conversation around ivermectin and hydroxychloroquine has some really good faith arguments on both sides. But very much so, when folks are looking for why could this be happening, if it doesn't make sense to them, because the communication's not there about why public health, why the CDC, why the FDA felt and made the decisions that they did around hydroxychloroquine and ivermectin, people are going to look for a motive. And financial incentive, I think, is where a lot of people's minds are going to go. I know that someone had mentioned earlier that there was, a requirement for emergency use authorization on a vaccine, that there couldn't be pre-existing therapeutics on the market that were showing efficacy against the disease. So, that's where I think a lot of people, get caught up in this financial incentive, because if we're not really talking about the experience that doctors and nurses who were administering this early in infection were having, and I'm saying this because my mom is a nurse, a unit manager of a nursing home, who very much had this experience with her patients. She very much felt like the only tool that she had was taken away from her. And that was very traumatic. So I think that there's absolutely a shared trauma on both sides and both sides of this conversation, if we even want to call it sides. But I think it's just, two different ways of thinking, two different approaches toward responding to this pandemic. And I hope everyone, actually, I shouldn't say I hope everyone can relate to the feeling of feeling helpless, because I wish that none of us ever had to go through that. But I imagine that there's been a shared sense of hopelessness, experienced throughout that.
Thank you so much, Elizabeth. Aaron Rossi from MAHA.
Yes, I would like to address a few things. Mostly in response to Reed's question of what could we have done different. So the first thought I have is, in regards to changing definitions, back in March of 2020, the CDC went against 3 different federal laws and altered the reporting of what is the cause of death. That little change increased the numbers of death by 17-fold. Now, absolutely, COVID killed people, but what we were attributing death to COVID may have been rather exaggerated. Dr. Offit mentioned the PCR test might not have been the best choice. Well, the PCR test, right, the way in which it found positives so readily definitely ran up the case numbers. And then while we were all scared, yes, people were coming to harm from it, but also the media unrelentingly was reporting case numbers, right? And other kinds of health challenges, they might report deaths, but the media chose to report case numbers. And I think in no small part because it was more dramatic, it was more scary. You look at the way it sounds as though everyone in medicine was really waiting for this vaccine, but early treatment was working. Yes, ivermectin, hydrochloroquine, that had its effects. The thing about hydrochloroquine having a large study published in the Lancet saying, no, it's dangerous, it doesn't work. Yet 2 months later, it was retracted because the data proved to be not worthy of it, right? So as a layman, it certainly sounds like people are quite motivated to detract from early treatments just so that we could make sure we had the EUA qualifications to get this vaccine out. That sows distrust. Then when you start releasing the vaccine, granted, like Dr. Offit again said, there was this big trial, 30 to 40,000 people. Yet in that trial, they unblinded the controls. And they let that 20,000 people who were a control group suddenly be released to take the treatment. And so then that completely alters the effect and the ability to measure how is this thing working. Finally, when you release this vaccine into the public, you had over 1,200 different deaths reported. Now, I'm not talking about VAERS yet, but I will. Those 1,200 deaths reported, that alone, like I'm not a public health expert, but I understand that safety should trump efficacy. And so when you have adverse events start being reported, there should be a pause on it, but there wasn't. People blew right through it. The FDA paused the Janssen shot after 6 cases of dangerous clots, thrombocytopenia, right? Yet over time, you had over 500 lethal cases of myocarditis, and still it kept being pushed. It kept being pushed. Now, the whole thing about what to do different, right? Again, Dr. Offit mentioned the way that they might have been heavy-handed and dictatorial. That is an understatement. You threaten everybody's work, their livelihoods, for a shot that is still brand new. It was an EUA, right? On top of that, the EUA provides immunity to the manufacturer, so there is no liability and there is no recourse, and all the risk is pushed towards the end user, who is being coerced more so than most adults have ever in their life. In 2022, just a little stat here for you, 1,100 athletes died of fatal heart attacks around the world. You'd have to go back 30 plus years to find the same number of athletes dying from fatal heart attacks, except 2022 was the year that everyone was mandated to take the shot. If giving us a shot to use, okay, right? But the fact that its safety profile was not at all established. The fact that that there was plenty of concerns, and the fact that the concerns were shut down. Again, going back to early treatment with McCullough and Piers Corey, for instance, they were talking about early treatment early on, and they were censored. Now, I'm not going to hold any of you responsible for the way social media aggressively censored people, but there was still a teaming up of government and social media to make sure the only thing that could get through was this official narrative. That does not contribute to trust.
And Zink, Dr. Zink, please.
Yeah, great. Thanks. I had a couple comments and then I also had a question back for the group. I really appreciate the conversation. I sometimes feel like, healthcare, we're stumbling into walls because we don't understand the healthcare system. And I feel like sometimes this conversation too feels like stumbling into walls and being frustrated with problems because things happen and real trauma happened, but not always understanding the systems that created that. And I think the more that we can have honest conversations about where those powers lay and where those systems lay, we can do more to change it to be able to move forward. I really agree with Brenda, your point about like safety has to be paramount and first and foremost. But in my like middle ground of where I sat in the space, I was a state health official and, Melinda, I had no idea why the CDC would change things. Like, I'd be like, here it is. And I'm trying to communicate that to the public. And I'm like, okay, here's what I know. Here's what we've got. Here's the studies. We basically had hour-long Zooms every single week that an entire public was open to, where we'd have our entire team. I would learn things on a regular basis. People would be able to bring back conversation and we'd be able to have two-way conversation. Alaska never mandated a vaccine. I get death threats still on a regular basis for mandating a vaccine. We never did, but private businesses did, federal government did. There were multiple entities within that. And so people are really angry at me. And I understand it because there was a lot of trauma for so many different reasons that was incredibly hard in that space. And, if I could just accept that and ease that pain, I would, but that would also be lying to the people who are mad because then I'm telling them that I had the power to change something that I didn't have the power to change. And I want to be honest about where those kind of power structures lie so that we can think about how to move forward and move on. I wanted to highlight one thing that we had talked a little bit about treatment and about ivermectin. I think that we're also coming out of this on the tail end of the opioid epidemic. And I don't think we've really had that conversation where we've seen, we were really told that opioids were safe. And if you weren't listening to a patient and just giving them the pain medication that they needed, you weren't hearing them and you were making a decision for them. I remember in residency getting written up for not writing 120 Percocets for a patient on my ortho clinic because then they would call back to the clinic. I think we saw really the harm that did. We pulled back on a lot of ways for that. But then we saw malpractice and being charged, both from our clinical standpoint, losing licenses and the rest of it, when we were just giving patients, quote, what they wanted at that time. So then you layer on top of that, the COVID pandemic. I think pharmacies had a real concern, doctors had a real concern, hospitals had a real concern of like, do I have enough data to be able to dispense this medication or to be able to share it? Again, like the state of Alaska never said you should or shouldn't take this medication or this is a good treatment or not. We said, talk to your healthcare provider. But we saw hospitals, we saw physicians not wanting to make that decision. But I think we need to put it in the context of kind of where malpractice is, the trust that happens on both sides. Joy, I keep thinking about back to your conversation just at the beginning. And I think something that also we haven't really talked about, and I don't need to push things back, but I feel like I would be disrespectful to the honesty of this group by not saying it. I'm really worried that because of the tension between healthcare and the public in so many ways right now, that there is more mistrust of healthcare providers with their patients. And I'm worried the impact that is going to have on patients as a whole. I think that, doctors have twice the suicide rate as the military, which is higher than the general public. People are less and less willing to go into public health and healthcare. And the more that there is this standoff between a patient and the provider, we all suffer because of that. And so getting back to that question of like, why should I trust you? Is because we are in this together and we have to figure out a way to be healthy and well together. And I'm worried that the blaming that's happening and the finger pointing is leading to, I see it in clinicians all the time. They're like, fine, I'm just going to do whatever they say. And I'm going to get out of the conversation because they're going to be so mad. I'm like, but you have to work with people. You have to hear them. You have to walk side by side. And so I would just challenge us to say, like, there's a lot of mistrust on all sides. And then the question I had for the group was, I really struggled with like when I'm sitting there side by side with a 35-year-old gentleman who's sitting in his 30s. He's got 4 kids. His wife's in tears. He's dying of COVID. And he's looking at me and he says, I see you on TV and you never told me it would be this bad. Like, this is awful. And why is it so bad for me when everyone else that I know only had mild disease? And I have 30 seconds on TV to summarize that, explain, and that story and experience with the nuance. It's incredibly hard to put both of those things back together. And so I think we need to I would love to know what I could say in 30 seconds that both captures that that distrust that that person had and the distrust for the person who had very mild disease and was totally, that someone says that the federal government tells me I have to take this vaccine, but I have no authority in that space. Like we have such limited space in there. I don't know how to communicate that in 30 seconds.
Yeah. No, I appreciate that, Anne. And I would say that, part of why I think these conversations are so crucial is because, doing this all in the middle of a pandemic, it just sets everyone up to fail, in my view. Okay, let's go.
Could I say one quick thing to Anne, just
Is that
directly?
Ashwin? Yeah.
Yeah. Hey, I don't think you can do it in 30 seconds. And I think that's a huge lesson that we need to figure out quickly is the way we communicate has to fundamentally change. The commercials and the edicts and the directives may be necessary on some level, but they're not sufficient. And so one of the things we did here in New York, we had a lot of vaccine hesitant and vaccine skeptical populations here in New York City. You wouldn't think of it given the uptake, but there's a lot of communities here with historical mistrust who've been ill-treated by the healthcare system, largely communities of color and immigrant communities here in New York because we're so diverse, right? We did, in the 6 months leading up to the release of the vaccine, because we knew it was coming, we did over 3,000, I think, community conversations and just did like small group meetings with anyone and everyone across the city on Zoom, in person, mostly on Zoom. But we talked, and none of that gets talked about.
We did that too, but
all.
it's not sufficient. It's not sufficient.
That's not sufficient, nor are the commercials, right? Neither of those. We have to have grass tops and grassroots communication strategies to get to people. And it takes time. The 30-second snapshot of like trying to distill the kind of nuance of whether this is a short immunity, long immunity, the duration of protection against this level of disease versus that level of disease, just impossible. It's impossible for us in public health unless you're having a consistent conversation. Like in those daily briefings that we saw officials do, that I did, rather than just talking about the numbers and talking about, the policies, really having a dialogue about the science. I think this is testing us in our scientific communication in some new ways. And I hope we'll be up to the challenge. I hope we'll be up to the challenge in the future because we have to be. Again, I go back to that analogy with my daughter. Every single decision I make with her is a conversation because she's got so much information at her fingertips. She can chat GPT the answer and say like, well, I don't know, Dad, you're wrong. And then I'm on the back foot, right? So rather than be on the back foot, everything's a dialogue. Everything is a conversation. And we usually get to the same place I want to get to. I know that might ring with you the wrong way, some of you folks, because I'm not saying this is like paternalistic. What I'm trying to say is that anytime you hold knowledge or skills that someone else doesn't have, it's incumbent upon you to meet people where they are and to talk more and explain more and give more information. And that's a big learning for me as a clinician, but certainly as a public health official.
Thanks, Ashwin. Let's go Mel from MAHA.
And I wanted to say, and just everybody in public health, I've heard this before that people have said, they've received death threats. That is completely unacceptable. I mean, I can't, I'm shocked that people treat others that way. I would never in a million years do something like that. As vehemently as I may disagree with some of the things that, that public health or doctors or the medical community has done, said, even to the point of obviously in the middle of a lot of the mandates and the COVID vaccine, I mean, I was hot under the collar. I would never in a million years threaten someone. And I think it's awful. And I'm sorry that you've had to go through that. And I think that's awful. So anyways, I wanted to get that said. But one thing I did want to ask was, we talk a lot about safety. And, I just have to ask, has anybody watched any of the committee meetings that Senator Ron Johnson has had with the COVID vaccinated and injured? Do you know the name Maddie DeGarry? Do you know the name Brianne Dressen? There's also a documentary out that I think won Best Documentary in Santa Monica Film Festival. It's called Follow the Silenced. And, I would, if you haven't seen it or don't know about it, public health, then I would say, please watch this. I think we need to have an understanding of what's going on. I mean, I have a few people that were injured and know a few people, including, one who died. But I personally am not injured. I didn't take the vaccine. I don't have a child who was injured, but I have so much empathy for these people because I feel like a lot of them felt like they did the right thing, the right thing that we always tell people, look for the good, right? Look, do it for society, do it for grandma. And these people did it. And then they were dismissed and, told that they had anxiety. And then because we aren't recognizing this, there's no treatments for these people. They're struggling. They're having, they can't work. Maddie DeGarry, she was put in the Pfizer trial, along with her sister. Her sister got the placebo and Maddie got the vaccine. And her life has never been the same. She's a young, teenager who, her parents were told, well, if there are any, issues when they signed her up, we'll make sure to take care of her. And Pfizer dropped her like, a lead balloon. And this girl now has a feeding tube. She's in a wheelchair. These are the things that I know that you guys have trauma and have been through seeing patients die and all that. And I have trauma on this side of watching these horrific stories of people who have been so injured. And I feel like their stories are just buried. And so my question to public health is, do you know about these? Have you watched any of those meetings? Do you know about Follow the Silent? And would you be willing to watch it? I know it's going to be a hard thing to watch. Would you be willing to?
Mel, I've shared the film with a few people because I've seen almost all of it. And so I know a few have it. And I also know that when Senator Johnson held the hearing recently, there were several folks from public health who were following along. I don't know if everybody on this Zoom was, but I know several in public health were. And if you'd like, I have the movie. I will share it with everybody. Joey, did you want to quickly add something?
Just a tiny piece. And I just want to say I'm compassionate for, the people in the medical field who were in the middle of the war. I do have compassion for that. And I have a 21-year-old son who is always about conversation about everything except his health. He completely trusts me. And I walk in and hand him something. He puts it in his mouth. He takes it because there's trust. Again, going back to what this podcast is about, why should I trust you? There has to be a way for the other side to earn our trust back. Thank you.
Thank you. Ashwin, did you want to add something?
Well, I mean, it's a great jumping off point, Joey, because I wanted to put a question to the group, a hypothetical. Let's imagine that in the next year, public health, whatever you want to define that as, government, non-government, comes out and says, we got everything wrong. We say it in Washington, we say it in capitals across it. What happens then? Because I think you're not saying that government or science or academia or any of these places shouldn't have a role in our health system or shouldn't have a role to use their expertise for good. But you are saying that trust has broken down to such a level that it's difficult to move forward. And so if there was a widespread admission of some sort, what would happen next? What then? Because I think we could spend hours on the various decisions throughout the last 5 years. And maybe that in and of itself is a good use of time. But I'm curious about, like, we were looking ahead, right? The first question was 30 years from now. How do we get to a place where 30 years from now, we're not having these same conversations? And what if we got out there and just said, you know what, we fucked up. We fucked up A, B, through Z, right? What would happen then? What would your reaction be? And what would you offer us as sort of next steps on what to do? Because I think there are many of us who see the challenges of the response and who admit there were many, many things that could have been done better. And I count myself as one of those, and the people on this call are included. So I'm kind of thinking, what's next? We are with you in the sense that we want to learn from this and do better next time. But I'm trying to turn this from a look back to a look forward. Yeah. I'm wondering if you have a reaction.
Joey, he addressed you specifically, so why don't you respond?
I would say probably the most important pieces are be careful about changing vocabulary or definitions without explaining to us, why you're changing the definition. I would say clearly create an environment where there are choices. It's very easy to say in the short term, we are in trouble. Our country is in trouble. Right now, please do one of two things while we're trying to figure this out. Stay home, wear a mask, or take the vaccine. In the short term, give us choices. Don't call it a vaccine until you have come to a world where it either is a vaccine or change the name of it so that we in our heads can see the difference between the two and decipher for ourselves and our family how we're going to respond.
Thank you. That's super helpful, Joy. Thank you.
Yes, sir.
Thank you so much. Paul, go ahead.
Okay, so I guess I'll say the unpopular things. I guess I've lived through this for a while. In the early 1980s, there was a film that was produced called DPT Vaccine Roulette, which basically told this story. My child was fine. They got this pertussis or whooping cough vaccine, and now look at them. And you would see it was very dramatic. It was children who were seizing, who had bicycle helmets, who were staring vacantly in the sky, withered arms and legs, and that was it. The whooping cough vaccine was causing permanent brain damage, epilepsy, developmental delay, et cetera. And so the public health and academic community responded by doing study after study after study, looking at children who did or didn't get that vaccine and making sure you controlled for all those confounding variables like healthcare seeking behavior, medical background, socioeconomic background, so you could isolate the effect of that one variable, receipt of the whooping cough vaccine. And it didn't cause permanent harm. And so there was that. Then you fast forward like another 20 years and you get Andrew Wakefield's publication of the study that MMR caused autism and the movies that came with that, like Vaxxed 1 and Vaxxed 2. It's all the same, which is that here my child got this measles, mumps, rubella vaccine and then descended into autism. 24 studies have been done in 7 countries on 3 continents looking at that question because the public health and academic community responded and found that MMR vaccine doesn't cause autism. Nonetheless, people continue to say that it does. So I think that vaccines are designed to prevent vaccine-preventable diseases, but they don't prevent everything else that happens in life. I mean, my wife is a private practicing pediatrician. She was helping the nurse give vaccines in the office one day. So there's a 4-month-old sitting on her mother's lap. While my wife is drawing the vaccine up into the syringe, the 4-month-old has a seizure, goes on to have a permanent seizure disorder, epilepsy, and is dead at age 5 of a chronic neurological condition. If my wife had given that vaccine 5 minutes earlier, I think there are no amount of statistical data in the world that would convince that mother otherwise, right? I mean, it's a very emotional event. But I would say this. I think that we have to be open-minded to the fact that there may be harms that are caused that we hadn't anticipated. I mean, nobody would have expected that the COVID vaccine would cause myocarditis. Although it was generally transient, self-resolving, and short-lived as compared to the myocarditis of COVID, which was a killer. I mean, we had children die in our hospital of COVID myocarditis and COVID pneumonia. So, I mean, but the vaccine was different. Nobody would have ever anticipated that Johnson & Johnson adenovirus vector vaccine would have caused clotting. No one ever anticipated it enhanced the secretion of platelet factor 4, but we were open-minded to the fact that this really, really rare event, 1 in 250,000, happened because we picked it up in post-licensure, post-authorization surveillance systems like the Vaccine Safety Data Link. No one would have ever anticipated that a swine flu vaccine in 2009 caused narcolepsy, a permanent disorder of wakefulness, which was picked up. This was a European phenomenon here, but 1 in 50,000 people. So you can't have the hubris of thinking that the vaccine didn't cause something that you hadn't imagined it would cause. I would never imagined the rotavirus vaccine, the so-called Rota Shield vaccine, would have ever caused intussusception, which is what drove it off the market. And J&J's vaccine was driven off the market. And the oral polio vaccine ultimately was driven off the market in this country because it was a rare cause of polio. It was the only cause of polio in the 1980s and 90s. So we have to be open-minded to that. I'm not saying that. But I think the vaccine adverse events reporting system is misnamed. It should be called the suspected vaccine adverse events reporting system, because not everything that's reported there is actually a consequence of the vaccine. So what I'm saying is that I do think the academic and public health community responds. I don't think there's a big attempt to sort of, cover up things that as driven by the pharmaceutical companies. I just don't see it. So I just thought I would say that unpopular thing. And now you understand why I actually do get hate mail and the occasional death threat. But it's nice to know that I'm not going to be getting them from you guys.
Let's go Ann Zink from Public Health, please.
Yeah, I'll go really quickly. A couple things. I think first and foremost, we're all saying the same thing, that safety and trust is paramount. That health decisions have to be grounded first and foremost in the belief that treatments for illness are vigorously scrutinized, that medical professionals have the information that they need, that we are able to be transparent about that, and what we're recommending is safe. Nothing, however, is free from risk. I will oftentimes said I'd much rather recommend COVID vaccine than ibuprofen to the entire population because the risk of GI bleeding and other consequences. I mean, we see about half of the liver transplants in this country are because of Tylenol overdoses, which is available over the counter. So everything we do has some risk to it. And so I think we have to be just really honest about the risk and benefit. And I think there's been really good conversation in that space. And Joey, to your point earlier, like we need to make sure that we have trust. And, to Austin's point, I mean, the governor used to tease me. He's like, "You want to meet with everyone in the state individually, don't you?" And I'm like, "I'm really trying. Like, I really am trying because everyone comes from a different perspective." The one thing I also just wanted to go back to that trust component is, something that was surprising to me when I stepped into this role as a state medical officer. Someone said to me really early on, I said, "How can I help?" And she said, "You represent God and government, the two things that have destroyed my community." And that was really humbling to hear, like all of the ways government was very harmful to her and her community. And now I sat in that role. And it made me really think about the role that, as Ashwin had mentioned, of privilege of having in that role or in medicine, having access to resources. But I think also having a microphone comes with real privilege as well. And thinking about the mistrust that happens. Melinda, I really appreciate your comments about the death threats. And, what I would oftentimes see is people were really angry because of shared hurt, shared trauma. No one wants to see someone they love or die get sick because of something that can be preventable, be it a toxic exposure, be it from PFAS, be it from toxic exposure from a vaccine that they are concerned about the risk of it. And there's real risk. I'll never forget in Alaska, when we started to roll out COVID vaccine, one of the very first person to have an anaphylactic reaction in this country was in Alaska. And we were like immediately trying to figure out, should we stop the entire nationwide, potentially worldwide COVID vaccine about that? And to see the scientific community like come together in mass to understand that case really, really early on and to say, we need to understand this because we may need to pause this entire thing. We need to be honest. We need to be transparent. We had a press conference where we had like the doctor who was sitting at the side by side with all sorts of experts from around the world trying to understand it with the public in real time. Really, honestly, for me, helped me to build and understand that trust. But I want to continue to encourage us to think about how do we drive our conversation towards shared values while we're being open and critical of the process, because I worry that things can be taken out of context so early, and then that can lead to mistrust. So that was just my last comment there. Thanks.
Thank you, Anne. Aaron Rossi from MAHA.
I particularly want to say, Anne and Ashwin, thank you for your vulnerability in the questions. Like it matters, and I appreciate it. Ashwin, for your question specifically about like looking forward, if what if they say that we got everything wrong, we totally fucked up, what should we do? Like, that's a great question. I was thinking about that, and I would say, like, kind of referencing what you just said, Anne, where like you had someone had a reaction, right? And the whole community comes together. It's like, what that reminds me of is the kind of the engineering way of thinking about things, where like the people who are closest to the problem get to call the shots. Right? Like the people who are on the street and face to face with people, seeing things on a personalized basis, let them have a little more authority. Like I know I don't know what it's actually like in the medical part of public health, but it certainly feels like it's a very top-down driven thing. The people who are not at all close to the problem get some access, some filtering of data up to them, and then they make a top-down decision, and then it's filtered back down. But giving someone on the street a little bit more like health professionals close to the person, a little bit more authority, a little more autonomy. I know I have a medical doctor who's a friend. That's one of his things he requests. It's like, let me be a doctor. Let me do some doctoring, right? But yet you guys are so much under the thumb of all the authorities over top of you, insurance and administrators and so on. It's like your creativity, and my observation, is stifled. Anyway, I also want to respect that you guys are willing to take this cold shower and have this conversation. So it takes courage. I respect that. But so I would say one other thing really is transparency, right? If we can't, like, you guys are talking about communicating better, and it's not just that. Like, the system itself needs to be built around a lot more transparency, and as a stemming from that, it needs to be frankly obvious that there is no conflict of interests. And I think, I don't know if I'm putting words into your mouth, Dr. Offit, but like, when you're saying you just don't see it, like, well, we'll just have to agree to disagree on that. Because from my vantage point, like, looking at data, there is a lot of, like, conflict of interest of things, and pharmaceuticals' influence on everything is profound. So I do see that.
I agree. Actually, I agree with that. I don't see it so much on the vaccine side, but I think, because vaccines aren't big money makers, but I think, with the exception of the COVID vaccine early on, no, I agree with that. I think that, actually, I agree with a lot of these things. I think that we over medicate our children. I mean, I looked when my son used to eat Lunchables. I made the mistake of actually reading what was in it. I mean, it's frightening. I'm with you more than you think. It's just, I guess I've been in the vaccine world for 40 plus years, and I just don't see things that are nefarious there. I don't.
Well, I kind of was a small little counter addressing, and I thank you. I appreciate this conversation, actually. Like, the way again, this is about trusting, right? So the way I see this is, you look at the pharmaceutical industry and the way that they're implanted in everything, right? Like, deeply in everything. If you look at not the vaccine aspect, but just their medication aspect, in the last 25 years, they have been found guilty of various crimes and civil penalties over 1,000 times. They have $87 billion worth of fees just from the stuff that they can be sued for. So if a pharmaceutical industry conducts itself that horribly in the areas that they can get sued, why would we assume that they would be so ethical in the one area of their business model that they cannot be sued at? Well, they have no liability and completely shielded from it.
Right.
Now, you may have a good answer, but maybe from a layperson's perspective, that makes it ripe to not trust it, because why would they be?
Okay, so here's what I would say. Do I think that pharmaceutical companies act aggressively, unethically, and at times illegally? Yes. But I don't see it on the vaccine side. I understand your skepticism. I think you should be skeptical about anything that is a money-making operation, no matter how much it is a money-making operation. But I'm just saying, just because it happens doesn't mean it always happens. You know what I'm saying? So you can't have this sort of uniform, they're always acting illegally, but when that's not true, because it wouldn't be true. It's sort of like,
we'll agree to disagree.
Okay. And what I'll say is, on that, it would be a great, I think, its own conversation on corporate influence, because I know that is, quite frankly, something that both sides think a lot about. I think MAHA has done a terrific job of really spotlighting it as an issue. And frankly, as someone, along with Tom Johnson, has covered corporate influence as journalists, I think it deserves its own conversation. Mel, go for it. From MAHA.
So yeah, I want to address that idea about, the pharmaceutical companies and Dr. Offit, you saying you don't really see a cover up, but then there are things that we know. One of them is, Maddie DeGarry's, the teenager who was injured in the Pfizer trial. Her mother, testified that at the end of the day, she left the trial, and despite extensive damage, there was a finding in that trial that basically, I don't remember what exactly it said, but it was basically like a stomach ache. Well, I don't consider a girl who's paralyzed with a feeding tube a stomach ache. And so, yeah, I do think that they have the power to do these things, to kick people out of trials, who got injured, to manipulate things. And the problem is, there's not enough pushback.
Can I say one? Thanks, Mel. Here's what I would say. I think that what would be of value. First of all, I don't think that the courts are a place to determine scientific truths. I think scientific truths should be determined in a scientific venue. But let's say that this girl who was horribly injured, or at least horribly affected by what appears to be the vaccine, there are centers called, you need a better advocate. So there's something called the Centers for Immunization Safety Assessment. There are sort of they're dotted throughout the United States. I can help you if you want. Try and see if we can hook her in to one of those groups, which will then look more carefully to try and answer the question: was it a vaccine? And if so, what about the vaccine? I mean, because that's what we learned from, for example, the narcolepsy problem or the clotting problem. We learned the biological mechanism by which that happened. That would help. I mean, it would help other people too, because right now you're sort of limited to kind of shouting from the sidelines because you don't have that access. So CISA centers, take a look, and then we can, if you want, I can try and help you hook in to one of them. There's one at Hopkins with Neil.
I'll try and see if I can get information on how to get to Maddie to Gary. I mean, look, she's been out there. Her mom's been advocating for her, so I don't know if they've gone through this or not. That CISA, but it's worth a shot. It's just the problem is there are so many of them, and they're not getting help and they're not getting heard.
Well, if there's a group of people like her, I mean, that makes it even easier, because now it's much easier to do that kind of study.
Well, I'll put you guys in touch, and if you can, if you want to collaborate on that, Joey.
Yes. Again, going back to why should I trust you? I love this podcast.
I gotta hire you, Joey.
I pull it back. So what I'd like to see happen is our country and our medical field circle the wagons around all these moms that think it's the vaccine that was giving their child this situation, because the mom took their baby to the doctor gave them the shot, and the next day the child's life went out of their eyes, their speech disappeared. Okay, if it's not the vaccine, then why is the movement not toward what it is? Let's circle a wagon around these parents. Let's take care of these parents. Let's make sure these children get taken care of. Let's have a huge country movement to find out what it is. It's just we're being told it's not the vaccines. And then the conversation ends there.
Thank you, Joey. And Ashwin, take us home.
Yeah, really quick. And it was touched upon, and I'm thinking a lot about Joey's underlying subtext. Like if there isn't a baseline of trust, then none of this really lands. The financial conflicts of interest, I'm not talking about vaccines. I'm talking about sort of broadly in healthcare, with elected officials, with the way that our health system is set up. On top of the affordability issues of care, on top of the kind of user experience of interacting with healthcare, like insurance companies in particular, but all these other layers of the health system, I think that we are at a moment broadly of a crisis of confidence in our system. I think there needs to be a pretty big effort at conversation and reform, more on the governance and legal side than there is on the scientific side, I would argue. And that's going to require some bravery, which is in short supply politically, right, at the moment. I've been looking back, I'm doing a lot of writing and thinking and stuff, and I'm looking back at moments in history where we've had these big crises of confidence, big either public corruption or something like this. I'm not accusing anyone of or alluding to the fact that there's any corruption here, but half the country thinks there was, right? Half the country thinks that there was something deeply corrupt about the COVID response. And so the closest thing I can think of is like Watergate, where after Watergate, we had these hearings, we had reform, we had the establishment of the Federal Elections Commission and campaign finance laws, and to try to build up confidence once again in our democracy. Now, obviously, decades on, that's being torn down or has been torn down. But for a while, that worked to shore up confidence in our elections. I have a sense that for healthcare and public health, I think we need to do something similar. And I think we're at a bit of a Watergate moment because I don't think all these conversations and the small examples, which are big examples, but the details land less powerfully if you don't have this subtext of broader scale kind of reform and the definancialization of healthcare, which is just out of control. I think I've never worked for a pharma company or a health plan. I know that hospitals are also a player in all of this, but we all have to look in the mirror and kind of say, like, wait a minute, have we gone too far in the way that our system's constructed, and try to pull it back? And I think that's what Paul is saying. It's what Anne is saying. Everyone on the public health side knows this, but we need to be stronger fighters for that. And so I just wanted to end there for me, at least.
Thank you for that. And, as a former member of Legacy Media, we haven't talked about the role of the media. And I will say that with the internet and with media, the way that we know what the other side is about gets amplified and, quite frankly, distorted in many ways. Part of the reason why I'm doing this is I want to take us out of that distortion field and just directly have you all communicate to each other about what you know and what you see. I just want to thank you so much on behalf of the show, Why Should I Trust You? And both MAHA and folks in public health and science, thank you so much.
Okay, that was the conversation.
That was it.
Yep. I don't have many closing thoughts. I think that folks should just kind of reflect on what they just heard. But, our intention is to meet with the group again, to have these groups meet again. And Tom, I think, we're starting to hear from folks around the country that they're really interested in this model and would be eager to have it repeated.
Yeah, that's right. And when we talk, with all members on the conversation, hey, are you good with us, posting this conversation and sharing it? And everyone says yes. And I think there is perhaps a little bit of optimism that if we can model these conversations and show how you can have a respectful back and forth and how we can move past the caricatures and the kind of warring parties, we might be able to make a little bit of progress towards building back that trust. I felt certainly with this group, some of that trust was coming back, even though I'm not to sugarcoat it, there's pretty fundamental differences in how all this is perceived by everybody.
Yeah, look, this takes time. Things don't just change after one conversation, but I think even bringing people together to have the conversation is a step in the right direction. A huge thank you to the folks in public health, the doctors who joined us, and as well as a huge thank you to the MAHA supporters from Georgia. And please send us comments, questions you have at questions@whyshoulditrustyou.net. We will be back on Thursday. You don't want to miss Thursday's episode. It's going to be terrific. And I'm Brenda Adhikari. He's Tom Johnson. Thank you so much, and we'll see you on Thursday.